Hello, everyone. I will share my screen. Okay. Today, I'm going to talk about menstrual migraine should be considered a specific diagnosis. This class was administered in September 2021 in the Brazilian Congress of Neurology. For this presentation, I declare that I have no conflicts. And in my part, I need to defend that menstrual migraine should be considered a specific diagnosis. So yes, but it's not that simple to defend an idea. I decided to listen several experts by the world, around the world, with neutrality, with breathing, and listening and comprehension. So I sent emails to several experts around the world with two questions. Do you think menstrual migraine should be considered a specific diagnosis? Do you think menstrual migraine should come into the main body of the International Headache Classification, coming out of the appendices? And I sent emails to 25 experts and 13 answered the questions, okay? And the locations were Brazil, United States, and Europe. From 13 who responded, international were 5 experts, and Brazilian experts were 8. We had 7 women and 6 men. And 10 experts responded yes, menstrual migraine should be considered a specific diagnosis and should to come out from the appendices to the main body of the classification. Only 3 experts responded no. 12 experts allowed me to see their names. This one, no. This first expert said, separating these diagnoses from the main talk of migraine may give the wrong impression that there is a different pathophysiology. It's a very interesting point of view. The second, Anne McGregor, said, there was considerable resistance to concept of menstrual migraine being a distinct nosological entity. So yes, I do think that menstrual migraine should be considered a specific diagnosis. Diagnostic criteria need to be revised as the original premise behind them has clearly been misinterpreted. So until we have robust criteria, but once these have been developed, then it should definitely be moved to the main body of ICD 3-4. And Celia from São Paulo. Menstrual migraine should be considered a specific diagnosis. For about 300 years, there have been reports of menstrual migraine from the Netherlands and other countries. And that about 50% of women suffer from menstrual migraine. Being part of the main body would perhaps be taken more seriously with more studies and treatments. It's a very important point of view by Dr. Célia. And Gisele from Maceió, a beautiful place from Brazil, she said, I believe that there is already enough scientific evidence on pathophysiology and treatment forms because there are already well-established criteria for its menstrual migraine inclusion. Dr. Aline from São Paulo, Brazil, for 1 and 2 questions, yes, since the prevalence is high. And Dr. Speciale from Ribeirão Preto, for 1 and 2 questions. It should be a subtype, such as migraine with and without aura, hemiplegic migraine, abdominal migraine, etc. It's a very interesting point of view too. Anne Calhoun from North Carolina. She said, menstrual migraine is a specific diagnosis, and I strongly suspect that all of my patients would agree. And I also agree that it's time to get this very important diagnosis out of the sidelines and into the main discussion. Dr. Paulo Faro, Curitiba, Brazil. Some women who only manifest menstrual migraine have all the typical migraine symptoms, but manifest in the menstrual period without manifesting outside the menstruation, indicating that it's something isolated. It is a disease and it is a specific diagnosis and must have relevance to the point of being in the main body of the classification because it is something frequent and that even needs to have a differentiated treatment. Menstrual migraine has a set of different signs and symptoms and different treatments. Dr. Alan Rapoport, California. He said, I see very little pure menstrual migraine, but I see a lot of menstrually related migraine with aura. So it could be a specific diagnosis. I think it's just migraine, but it happens very often with menses and at the other times. It may be worse and harder to treat with menses. There is a clear trigger. For these reasons, it could be a diagnosis and it would help doctors to treat it correctly. How to treat it is complex. So I would be okay with having menstrually related migraine with less common or without aura brought in the main body of ICAG4. It's very, very interesting. Fabiola Dac from Ribeirão Preto, Brazil. She said, during this period, migraine has a different behavior, and because we have different treatments, many prophylaxis for this specific case. And experts that said no. Maria Eduarda from Rio de Janeiro, Brazil. She said, I have never seen a patient with predominantly menstrual migraine without one episode outside of menstruation. There is no new pain, but a defined and impactful trigger. And Dr. Elcio Piovesan, Curitiba, Brazil. It's a difficult answer. He said, it's a difficult answer. Certain menstrual migraine has a specific trigger independent of any other type of migraine. The semiology of findings during crisis is used for classification and not the trigger menses. If we considered this principle, I don't think it would be a specific diagnosis. If from a clinical point of view, some things characterizes menstrual migraine specifically, then yes, menstrual migraine should be considered an entity, but we can have in confusing situations with migraine from physical exercise, from sleep abstinence, and etc. And Dr. Metsudashina, he said, I do not think that menstrual migraine should be considered as a specific diagnosis. It's mentioned as appendix in the ICD-3. This allows to date there have been no sufficient data to label it as a separate diagnosis. Menstrual cycle could be a trigger of normal migraine, but you have to ask yourself, Masood asked to me, you have to ask yourself, what are the consequences of this inclusion? I thought about this, and I think that is a good consequences to include menstrual migraine in the man body. Let's see what's interesting thing here. The man body of the 1988 classification showed menstrual migraine in the community. Migraine without aura may occur almost exclusively at a particular time of the menstrual cycle, etc. It's very interesting. Menstrual migraine was in the man body. So it was the man body comment of 1988 classification. So there is menstrual migraine. Menstrual migraine exists. And a little bit discussion about this issue. We need to study genotypes from phenotypes and about the epigenetic influence of hormones. One study verified the role of 17 beta estradiol epigenetic modulator in the methylation of genes involved in migraine and considered to be epigenetically regulated, including ESR1 and several genes involved in CGRP pathways. Results did not suggest a significant effect of the estradiol on DNA methylation, but the authors acknowledged that the study had low statistical power, so hormonal effect cannot be excluded. Future research should also assess the effect of estrogen withdrawal on gene methylation. So, epigenetics and menstrual characteristics through trigger are favor menstrual migraine as an entity, are in favor. And post hoc analysis of women with menstrually related migraine for topiramate, tiranoumab, fremanezumab, and galcanezumab indicate improvement in menstrual migraine. However, they are post hoc analysis. No menstrual data were collected to confirm or refute the diagnosis of menstrual migraine in the world trials prior to the study. So many scales are applied in these studies, like depression, disability, and others. How difficult can it be to apply a diary of the women's menstruation, use of hormone, and if menstrual migraines occur the baseline period of such studies? We need to question the menstrual cycle of the women before the studies initiate. there are my considerations of astonishment about this. Menstrual migraine, so it should be considered as a distinct disorder, ensuring greater recognition and investment in research. The conclusions. Menstrual migraine can be considered a separate entity, not absolutely proven. It should then be placed in the main body of the classification, which may allow it to be taken seriously, to be further studied, including for better diagnosis and better forms of treatment. Findings about prolactin and common pathophysiological pathways between prolactin, estrogen, and CGRP, and the possible existence of epigenetics in this issue would place menstrual migraine as an entity like familial hemiplegic migraine is. Thank you so much. This is my Instagram. Would you like to participate in this poll about MM and menstrual migraine? About menstrual migraine? Wait for future notifications. Thank you.